I was a bit worried, do we have the ambulances ready outside? His Excellency the President, Madam First Lady, may I respectfully stand on existing protocols. Today is a proud moment for our nation, Sierra Leone, as we formally launch Sierra Leone's National Public Health Agency. This has been long in the making, and today is a fulfillment of a personal, as well as our collective dream as a nation. Your Excellency, you just put an exclamation mark on the principle of talk and do. Thank you. In the global struggles with epidemics and pandemics, we've always found ourselves chasing and reacting to the virus, the bug, or the agent. Today, with the launch of this agency that focuses on prevention, preparedness, and response, we are putting this nation ahead of these viruses, these bugs, these agents. We know that the effectiveness of a nation's response to the outbreak or an outbreak is predicated on how prepared the nation is, as well as the speed and efficiency with which they respond. What we do as a nation during quiet moments would determine how well we manage the hot period of an outbreak or pandemic. Distinguished ladies and gentlemen, what the President, Brigadier Retired Dr. Julius Malaview, charged us to do as the Ministry of Health is not to look at health as an end in itself, but to consider health as well as other critical human capacity, human capital development parameters as a critical platform for our nation's development. As we look at the National Public Health Agency, it is important that we view it within the broader context of our nation's health agenda. There are four major building blocks of that agenda. Number one is primary health care. Number two is secondary and tertiary health care. Number three is the referral networks between these healthcare systems. And number four is health security. Let me take a moment to talk about primary health care. Primary health care is the backbone of our nation's health system. The focus is to take health care to as close to the people as possible. With nearly 1,600 facilities spread throughout the country, 85% of our 7.5 to 8 million population have a health facility within a 5-kilometer radius. With that remarkable access, what we are now working on is expansion of the access points while focusing on quality of service at each of these sites. Quality indicators include physical infrastructure, energy, electricity, water, cleanliness, safe space. We're looking at other issues like staffing and staffing complement. We're looking at equipment and supplies. We're looking at drugs. We are moving away from siloed vertical programs to integrated service provision with a distinct focus on prevention in the communities and using patient-centered or client-centered care for service delivery in our facilities. We're shifting from a one-size-fits-all basic care package to care based on life stages approach, from a pregnant woman to the newborn baby, all the way to senior citizens. Let me take a moment to talk about our secondary and tertiary care. We are renovating, re-equipping, modernizing existing hospitals, as well as building several new modern hospitals with diagnostics and imaging capabilities to be responsive to the emerging needs of our nation. We're expanding the staffing complement, including new doctors, including specialist doctors, nurses, subspecialty nurses, midwives, and allied health staff. When fully operational, we will drastically reduce the need for travel overseas for medical care. The third component is the referral networks. With an effective primary care system as well as secondary and tertiary care systems, the referral network is a critical bridge linking the two systems. We will invest heavily in the ambulance service, the 117 systems, as well as the digital platform to ensure efficiency, quicker response times, and better health outcomes. We will plan on bulk procurement of prepaid fuel, petroleum products, as well as effective decentralized ambulance maintenance schedules. The fourth is health security. With the Public Health Agency as the anchor of our health security posture, we have a unique opportunity to design a system that best suits our needs. We believe that most outbreaks emanate from within communities and are first seen at remote outposts. By using the One Health platform and superimposing health security on primary health care, using embeds of field epidemiologists, tripwires, as said, ensuring early detection of unusual events and spikes in cases. This provides an opportunity for early warning and speedy response. Our determination is being exemplified by being the first country in West Africa and only the second country in Africa to subject itself to WHO's flagship program, the Universal Health and Preparedness Review. This underscores our commitment. We're grateful to you, His Excellency, for your continued leadership and for your assembling the best team imaginable with Professor Fodesa and Professor Erbakima to be at the helm of this new enterprise. We remain grateful for the continued financial and technical support from our multiple partners, including WHO, the US government, the government of the People's Republic of China, Africa CDC, World Bank, WAHO, JICA, UNICEF, UNFPA, to name but just a few. The launch of the National Public Agency is an important milestone, but the real journey starts after this launch. The concurrent launch of the National Emergency Trust Fund is our shield against uncertainties that may arise. Having ring-fence funds that allows the agency to respond to an outbreak for the first 30 days, even without external assistance, is forward-leaning. We have to have a really close look that when you're looking at hot situations, you have to be prepared during the calm period. This is what we're doing today. As a nation, let us be the architects of our own health destiny. As a ministry, as an agency, we want to reaffirm our commitment to protecting the life of every Sierra Leonean. As good citizens of the world, we are committed to doing the same for the rest of the world. Thank you very much.